and it can be very severe and very limiting at times. The causes of chondromalacia patella, if you're over 40, it's overuse. A lot of runners, a lot of people that do repetitious motion, hiking, running, riding a bike, if that just creates a wear and tear type of a situation on the underside of the kneecap, creating an arthritic change and softening that articular cartilage underneath. In teens, especially in girls, it's due to uneven pressures, and specifically in the Q angle changes. As we begin to talk to the young ladies here in a moment, they're that age where their bodies are changing very rapidly. Bones are lengthening, the pelvis is broadening. You have a Q angle, which is the angle from the pelvis to the knee. And in women, it is greater than in men, but if you have an imbalanced musculature of the quadriceps muscles, it will create this Q angle, and what will happen is the patella will then track in an imbalanced way and create a greater stress over a portion of it as compared to the other, and it creates an early onset degenerative change, and it creates a lot of pain situations. Symptoms of chondromalacia patella, like I mentioned, would be pain in the front of the knee, particularly around the kneecap itself. It's worse with squatting. This issue is with the kneecap, so when more pressure is put onto it in a squatted position, you're going to have an increase in pain. A more specific diagnosis for this in this stage of the game, because their body's changing so rapidly, is that you aren't actually getting the softening yet. So a more correct would be an anterior knee pain syndrome. Would be something that you might hear. This type of thing, if not dealt with, would absolutely lead to the softening of the articular cartilage. Treatment options. If you're an adult, physical therapy is the first thing. Surgery could be an option. However, the successes in that relieving symptoms is not very good. Primarily, we want to focus on strengthening and coordinating the leg musculature associated with what's going on, and then it is able to allow this to track more efficiently. In the teen group, you absolutely, exercises, rehabilitation is the easiest and best way to deal with this. And some of those would be short arc extensions, straight leg raises, and quadricep isometric exercises. And a little bit later, we'll demonstrate some of those. So I have with me today Laura Duncan and Alyssa Osterhow. Both of these young ladies are patients in the office. First of all, introduce yourself and tell us a little bit about yourself.
Okay. Hi, I'm Laura Duncan. I'm 15. I'm a varsity cheerleader at McDonald County High School, and I'm also a senior company dancer at Anderson Dance and Acrobatics.
Alyssa?
Hi, I'm Alyssa. I'm also a senior company dance and acrobatics dancer, and I'm a varsity cheerleader for McDonald County also.
Okay. These young ladies both are prime examples of the conditions which we're talking about. However, they do not specifically have these things, but we are talking about their activity levels and the things that they do. Dance, gymnastics, tumbling. Alyssa just recently fell off of one of the cheer platform things that they do when they build the pyramids. And so these types of things, not only is it traumatic when she fell like that, but they also are constantly traumatic upon themselves in the positions and the torques and the forces that they're going through. So tell me a little bit about being a cheerleader and doing the dance. Like, what parts of your body do you find you have the most discomfort and issues with?
Okay, well, I put a lot of pressure on my right ankle and my knees, but I also have a lot of soreness in my lower back and my neck.
Okay.
Mine's just my groin and my hips and sorry, my lower back.
Okay. And obviously, you know, most of these, like in both of their situations, we've dealt with them a lot with low back issues, which would be they do not have the spondylolisthesis, but it is that type of scenario. Actually, Alyssa's symptoms were very, very similar to what you would see. but is not that situation. And then we have them dealing with things in a way that allows their body to adapt more efficiently through utilization of chiropractic care. And we've taught them a few little exercises and stretches as well. So, Laura, tell me a little bit then, when your back is hurting and stuff like that, tell me a little bit then about how it affects what you're able to do. Are you still able to perform and do the things that you're...
Well, I'm usually able to perform. I just have to stretch first, and it's usually hurts more if I'm like bending over or arching back. It's more soreness and like stiffness in the muscles.
Okay. And for you?
Stunting, tumbling in the lower back and the groins.
So tell
That's where it
people about what
hurts.
stunting is.
You throw a girl in the air. She jumps in your hands and you have someone on the other side of you and you have a back spot who puts her into your hands and then you throw her up and then catch her.
Okay. All right, great. Then you've dealt with these things repeatedly because we've gotten to know each other over the course of the last year or so, and these types of things tend to be significant when they occur.
Yes.
And the more consistent you are with maintaining yourself, the less you have to deal with them, correct?
Exactly.
Okay. And then tell the people a little bit about what happens then when you come into the office and what kind of things we do and what helps and, okay?
Okay, well, usually I've been around it long enough to know exactly where it hurts and exactly what I have to get him to do. And so I'll go in and tell him where it hurts, and he'll tell me exactly what I need to get done, and then he'll fix me, and I'll be all good.
Same thing. It's like Humpty Dumpty. Get fixed again.
In this situation, because of their age and their ability to adapt so rapidly, most of the things that you deal with don't last very long and aren't very debilitating because, and you have to applaud you for this, you actually take responsibility for it and don't let it nag and nag and nag and nag. And that's the thing, their ability to heal themselves is so dramatic that so much of these things can be managed very effectively. And when we start to think about this from a long-term perspective, obviously there